Antimicrobial resistance, AMR, is when bacteria, viruses, fungi, or parasites become resistant to the drugs used to kill or control them. A critical intervention to combat AMR is the implementation of antimicrobial stewardship programs in healthcare facilities to promote their appropriate use. In 2023, Pfizer collaborated with Project ECHO to launch the TEACH AMS initiative. Healthcare providers join virtual communities of practice sessions to discuss actual cases with subject matter experts and their peers.
What ECHO does is it tries to discuss what actually resulted into the patient getting the infection and how did we manage the infection. Is it the standard way, or is it that we lacked a few things in the standard way to manage the case? And I think ECHO helps with the discussion that you might have limited resources but still end up managing the patient the correct way.
During the ECHO session, a pharmacist from the Nyeri County Hospital was able to share with the presenting facilities and all other participants how the nitrofurantoin tablets could have been constituted into a syrup, and even guidelines for what they would use to sweeten them, because the tablets are quite bitter, so that the syrup that's then constituted would be palatable to give the child. Through that one intervention made it possible to see how any other child presenting with a similar case would be saved the hospitalization and the painful injections. And from an antimicrobial stewardship perspective, protecting an important reserve antibiotic, in this case vancomycin, from being used and the exposure that comes with it, and the risk of developing resistance to such an antibiotic. This was a very good example of the value that ECHO adds in these settings.
Initially, we have very few labs, so it was very hard to network until ECHO came on board, and it was a real game changer in terms of sharing challenges, ideas.
In it, I saw a chance to even network and get to know other people in the field, people who I could consult whenever there was need.
It's a whole package on how you manage the patient, from the clinical perspective to the diagnostic perspective, the pharmaceutical aspect, and also management in terms of IPC and MS.
Every time we learn something new from the ECHO sessions, them being online such that we are able to connect with many people from various facilities where we can not physically be able to reach. That's very important for us. And also the timing is usually very convenient for us.
As of December 2024, TEACH AMS ECHO programs have been launched in 7 countries in Africa. That is Kenya, Uganda, Ghana, Malawi, Zambia, Rwanda, and Senegal, in addition to a multi-country regional program in Latin America. These programs have delivered 130 sessions with more than 14,400 attendances, representing almost 3,500 unique participants from 78 countries.